Dress a resident with a weak arm. Introduction. Patients often need assistance with getting dressed. CNAs need to be aware of each specific patient's abilities and weaknesses to assist them properly. For the state exam, the care plan will indicate the patient has a weak arm. It is important for you to pay attention to which arm is weak, because that will affect how this skill is performed. This skill will be performed on a mannequin. Weak arms are undressed last and dressed first to allow the old garment to be slid off easily and the new garment to slide up the arm easily without excessive bending or reaching. A great way to remember this is USA first. Undress strong arm first, then dress the weak arm first. Privacy is important in every skill, but it's very important when performing skills where the patient will be uncovered or undressed. For these skills, we use a privacy blanket, also called a bath blanket, to cover the patient with while we perform the skill. A privacy blanket is placed over the patient's sheet, and the sheet is then pulled down under the blanket to the bottom of the bed, so the blanket is covering the patient instead of the sheet, allowing you to dress or clean the patient easily. The blanket should cover all private areas of the body, the breasts and the genitals, at all times. The privacy blanket will be removed at the end of the skill and put into the dirty linen hamper. The patient will either need to be recovered with the sheet or completely dressed before removing the privacy blanket. This skill requires that you remove the patient's gown by undressing the strong arm first and dress the patient in a snap or button front shirt, pants, and socks. Remember, this is a mannequin skill, so the mannequin will not be able to move on her own. You will have to perform all movement while maintaining privacy. The patient has the right to choose their own clothing. You will need to ask the mannequin what she would like to wear as you begin the skill, and the evaluator will answer for the mannequin. Select the clothing that the evaluator describes. If the clothing the patient chooses doesn't match, you can suggest another alternative. For instance, if the patient asks for his orange plaid shirt and yellow pants, you could suggest that his black pants might match better. However, we always honor the patient's wishes. If you make a suggestion and the patient insists on his first choice, then that's what we'll dress him in. It does not matter if you put on the patient's socks first, pants first, or shirt first. In the video, you will see the instructor put the patient's socks and pants on first, then elevate the head of the bed to dress the upper body. This method makes the skill a little easier because the patient can lean forward. For the test, you will not be putting undergarments on the mannequin. You are only required to dress the patient in socks, pants, and a shirt. When dressing a resident, make sure the pants are pulled up over the buttocks and arranged properly, the socks are completely covering the feet, and the shirt is snapped or buttoned correctly. Presentation counts. Take a look at your patient when you're done to make sure she looks good. Remember to allow the patient to choose their clothing, protect privacy while dressing the patient, undress the strong arm first, dress the weak arm first, and presentation counts. Watch the instructional video for step-by-step instructions on how this skill is performed, paying close attention to which arm is undressed first and which arm is dressed first. When you have watched the videos, try this skill on your own.